The cornea acts as the front window of the human eye, taking incoming light and focusing it smoothly so we can see the world clearly. But that structural integrity fails when a patient develops keratoconus. Keratoconus is a progressive eye disease where the clear tissue of the cornea gradually thins and bulges outward into a rigid, irregular cone. The immediate optical consequence of this jagged shape is that it causes incoming light to scatter chaotically. Instead of a single, sharp image, patients experience severe ghosting, blinding glare, and intensely distorted vision. Because the physical structure of the eye has collapsed, standard glasses or soft contact lenses simply cannot correct the resulting blur. The first medical escalation for these patients is usually a rigid gas permeable, or RGP, lens. RGP lenses are hard contact lenses that attempt to force a smooth, artificial surface over the irregular eye. This introduces a mechanical flaw known as apical bearing. The hard lens ends up balancing directly on the peak of the diseased cornea, placing its entire weight on the most sensitive part of the eye. This constant friction causes immense chronic pain, creates lens instability during every blink, and carries a high risk of permanent corneal scarring. When patients can no longer tolerate the pain, standard care reaches an intimidating dead end. Doctors run out of lens options, and patients are told their only remaining hope is a highly invasive surgical corneal transplant. The conventional medical system essentially leaves these patients visually stranded unless they can access a highly specialized custom intervention. This is exactly why the Optometric Eye Care Center of Orange County exists. Under the direction of Dr. Alexander Bonnickdar, it operates as a premier referral destination for the unsolvable cases other doctors leave behind. The first mandatory step in treating these severe cases is corneal topography imaging. This rapid, non-invasive scan fires light rings at the eye to map its microscopic peaks and valleys, giving doctors the exact mathematical measurements of the corneal irregularity. You cannot engineer a solution for a collapsing optical structure until you have a precise map of its unique geographic terrain. Using that topographical data, the clinic designs a specialized biomechanical intervention, custom scleral lenses. Unlike standard RGP lenses, scleral lenses have a much larger diameter, engineered to vault completely over the damaged cornea without touching it. By landing softly on the sclera, which has vastly fewer nerve endings, they completely eliminate the pain of friction. The lens relies on a fluid reservoir to bridge the gap between the device and the eye. Before application, the deep bowl of the scleral lens is filled entirely with a sterile, preservative-free saline solution. This liquid fills that empty gap between the lens and the jagged cornea. The fluid neutralizes the irregular surface, functionally creating a brand new, perfectly round optical pathway for light to pass through. This chart shows the dramatic improvement in best-corrected visual acuity following scleral lens treatment, dropping from a baseline of logMAR 0.50 down to a near-perfect 0.08. Logmar is a standard scientific scale used to measure visual acuity, where lower numbers indicate significantly sharper vision. Scleral lenses are custom-engineered liquid prosthetics that mathematically erase the optical damage caused by the disease. Because these lenses are advanced medical devices, they require strict daily care protocols to function safely. Patients must use specific hydrogen peroxide systems or approved multi-purpose solutions for daily disinfection, and the use of tap water is absolutely prohibited. When filling the fluid reservoir, patients can only use single-use, preservative-free solutions to avoid severe toxicity to the cornea. Restoring perfect vision requires an active, ongoing partnership between the doctor's precision engineering and the patient's daily discipline. Clinical data translates directly into major human impacts. Validated NEI VFQ scores prove that patients regain their lost independence, suddenly able to drive at night and work on screens again. The NEI VFQ is a standard survey used to measure how vision problems affect a person's quality of life. This PRISMA flowchart reveals the clinical evidence supporting this treatment. PRISMA is a standardized system used by medical researchers to ensure they are only analyzing the most rigorous and relevant study data. This level of care highlights the sharp contrast between a standard one-size-fits-all routine eye exam and the relentless, bespoke problem-solving philosophy of the Keratoconus Vision Center. A diagnosis of keratoconus, or an irregular cornea, is not the end of clear vision. It merely demands a different tier of optical expertise. For those who have been told nothing more can be done, the specialized care at the Optometric Eye Care Center of Orange County proves there is always a better solution waiting. Advanced optical engineering restores the personal autonomy that a failing cornea takes away.